Hi, I'm Katie Kjarnson, Director of Strategic Accounts for Acteon.
And I'm Molly Mann, Northeast Regional Sales Manager for Acteon, and we are here at the Henry Schein headquarters in West Allis, Wisconsin to talk to you about increasing case acceptance in your office while using 2 new CDT insurance codes. But a little background information first. Periodontal disease is the leading cause of adult tooth loss. Despite its prevalence, periodontal disease is significantly undertreated. However, before a patient sees any bone loss, they will always have gingivitis first.
According to the AAP, half of Americans suffer from gum disease. 64 million American adults have mild, moderate, or severe periodontitis, which is the advanced form of periodontal disease. And in adults 65 and over, that number increases to 70%.
The problem is, periodontal disease is significantly underdiagnosed and it's undertreated.
When you look at it, there are significantly more prophies compared to periodontal therapies performed in dental offices across the U.S.
So how do we address this problem, Katie?
D4346 gives hygienists the ability to treat gingivitis when the patient has moderate to severe gingival inflammation and does not exhibit bone loss. This is huge. It's a treatment code for gingivitis.
This code provides an opportunity to better name the patient's disease, learn how to appropriately claim it for insurance reimbursement, and to treat the disease at its earliest stage so it doesn't progress into periodontitis. This is what Acteon calls name it, claim it, treat it. It literally bridges the gap between a standard prophy and an SRP.
So Molly, how do we get our patients to acknowledge that they have periodontal disease?
Trust is key here. It is gained when we enhance patient engagement in co-diagnosis, essentially owning their diagnosis and treatment. This happens when patients can see their condition rather than just taking our word for it.
In order to support the delivery of D4346, document the patient's periodontal charting and take photographs along with other diagnostic images. There needs to be generalized moderate to severe gingival inflammation in 30% or more of the patient's mouth. Wouldn't it be great if there was a tool that could actually show this to patients?
Well, there is. Acteon makes an intraoral camera called Soprocare. The Soprocare camera has a perio mode that uses fluorescent light to highlight gingival inflammation and calculus in color. This makes it easy for the patient to see and understand their diagnosis, and it allows us to show that 30% or more of the patient's mouth is affected by gingival inflammation.
Soprocare creates powerful communication images for the patient and for insurance companies. An experienced clinician can visibly detect inflammation, but to an untrained eye, like a patient, detecting inflammation is not that easy. Soprocare is also an impactful before and after tool for patients. Giving patients periodic reminders of what their mouth looked like before therapy and how much their tissue has healed is a great incentive for continuing care. Now that we've talked about periodontal disease, let's talk about the most common oral disease. Nearly every American has experienced this oral disease, which is dental caries. So let's play a game.
Okay.
What is the single most common chronic childhood disease, Molly?
I don't know.
Let me give you a little hint. It's 5 times more common than asthma and 7 times more common than hay fever.
Let me guess. Dental caries.
You got it.
Now I'm going to ask you a question. What disease affects more than 1/4 of U.S. children between the ages of 2 and 5, half of the population between the ages of 12 and 15, and more than 90% of U.S. adults over the age of 40?
Dental caries?
You got it.
This is a very common disease in the U.S., but the good news is there are safe and effective measures that can be taken to prevent and treat dental caries. There's also a new CDT code, D0600, which was created in response to this epidemic. D0600 is a procedure code for caries detection using radiation-free methods of diagnosis. This code moves caries detection into the 21st century. Dentists can now provide patients with a wide range of treatment options, as well as monitor outcomes, and it offers patients and dentists an alternative that does not involve radiation to detect caries.
Here's how the SOPROLIFE can help you facilitate the use of CDT code D0600. SOPROLIFE uses fluorescent lights to illuminate the tooth and identify healthy dentin in green and decay that has affected the dentin in red. Easily said, red is bad and green is good. The SOPROLIFE can be used to diagnose and capture both occlusal and interproximal caries even in its earliest stages. SOPROLIFE also allows you to monitor and quantify changes in the tooth structure.
You can see how impactful showing SOPROLIFE images to patient for treatment acceptance is. What's more impactful to you?
The SOPROLIFE image is so easy to understand and it is so powerful for patients.
Yes, the fact that SOPROLIFE highlights healthy dentin as green and dentinal decay as red really allows the patient to see their dentinal decay and accept their treatment plan.
I totally agree. SOPROLIFE can not only be used for occlusal and interproximal caries detection, but it can also be used while treating decay. Use SOPROLIFE while excavating caries. It will operate similarly to a caries detection dye, but it is more accurate and you can document that the caries have all been removed. If you would like a demo of the SOPROLIFE or the SOPROCARE cameras so you can begin to use these two new codes, a local Acteon rep can come to your office.
Please contact your local Henry Schein rep for further details.
Hello, Tyler Steck here. From Henry Schein to Acteon, our partnership together is a huge asset to bring these prevalent diseases to light in your dental practices. With the knowledge gained from Katie and Molly, you should feel equipped to challenge your doctors on how they detect periodontal disease and dental caries. Take a step forward in your territory. Work with your local Acteon rep and provide your doctors with the information they need to be difference makers.
From all of us at Acteon
and Henry Schein,
we thank you for watching this video.